Hi, I'm Dr. Santhoshi. I'm a consultant dermatologist and I practice in Aesthetica Veda Whitefield Bengaluru. The impact of mental health on skin conditions. So let's take them one by one. Let's start with something like acne, very prevalent. And most of us, 80% to 90% of us, have developed a pimple at some point in our lives, right? So we all know how we feel when we wake up and then we go to the mirror and the first thing we see is a red, angry pimple. And the whole day we are like, oh my god, where did I get this from? What could have possibly triggered it? I have to fix it. So it's a pimple, right? Many of us would feel like it's not life-threatening. The patients come into our OPD and they're really distressed, they're really upset, they're even anxious, they're sometimes asking you the same questions again and again. So we have a natural tendency to get a little irritated, to get a little frustrated as to, this patient is kind of obsessing about this acne. It's not even that severe. But we are not living in their heads. We do not know how that one pimple is affecting their mental health, affecting their confidence. Okay, maybe they thought, oh, I have a pimple now, I'm going to postpone my job interview, I'm not going to go for the job interview. So can you imagine the impact, the skin condition has on the mental health, and vice versa? Someone with mental health issues, for example, someone with OCD, obsessive compulsive disorder, okay, they tend to, ruminate on their, on thoughts. They have ruminating thoughts, repeated thoughts. They have compulsions that they have to perform to relieve the sense of anxiety. They have obsessive intrusive thoughts that they cannot get rid of, and it's not a pleasant condition to, have. Research has found that people with OCD, there's also OCD spectrum of disorders which has a direct impact on skin health, like trichotillomania. Trichotillomania is when you pull out your own hair. Okay, it's kind of a tension relieving activity. Many kids do it as well, but adults, into your OPD, they come, they walk in, they say, overnight my hair is, come off. And while you look, you see that there are hairs of different lengths, and also it is in the accessible area. For example, if the patient is left-handed and you find a chunk of hair pulled out from here, most likely it's not very, ergonomic, so to speak, right? So you have to look for these subtle clues. So acne, there's also a condition called skin picking disorder. Okay, it's an excoriation disorder where patients look into the mirror and they cannot stop picking at their acne. Even if there is no acne, even if their skin is unblemished, they cannot stop picking at their skin. Maybe they're preparing for their exams and they're constantly touching their face. Maybe they're sitting in their desk at work and there's some stress and they're picking at their face. But before you know it, you have scars and you have excoriation marks, and that causes even more distress. The patient becomes even more anxious and needs to be something that has to be done to relieve that tension. And what do they go back to? They again go back to picking at their skin. It's a vicious loop. Stress, skin picking, stress, skin picking. So it just keeps going on and on and on. So a patient comes to you with acne and you see that the severity of the disease itself, like the pustular acne, the comedones, is not as much as the marks, the redness, the scratches. You will have to think of acne excoriate, all right? And of course, when you're stressed, cortisol is pumping through your system, right? Cortisol is an endogenous steroid. It directly goes and acts on the oil glands that are the central pathogenesis of acne. They increase the oil production, they increase inflammation. So there's more inflammatory cells, the policemen like the neutrophils, they're all coming in, and finally you have a big red angry pimple. So during times of stress, acne severity flares, and when acne severity flares, patient becomes stressed, it just goes on and on and on. Vitiligo. Okay, when you're stressed, there has been research that found that the activity of the disease increases, even eczema. Eczema itself causes a lot of itching, so patients sometimes suffer from poor quality of sleep. And when sleep is poor, obviously everything else takes a hit. Your ability to perform at work, at school, people are drowsy, the children are not able to focus in school because they're constantly itching. The whole family suffers because the child is not sleeping, the mother and father are anxious because they have also not slept. So it affects their whole family. Okay, and then when they're stressed, of course the itching worsens, the itch threshold decreases, so the slightest irritant is enough to trigger a full-blown flare. So skin and mind go hand in hand, can never be separated. Every patient of any skin disease has to be inquired about their mental health, and people attending mental health OPDs should also be familiarized with spotting the skin conditions that can point towards what mental health illness that the patient is suffering from.